we know that there is evidence showing functional changes in the pons and hypothalamus during the premonitory pain and interictal phase of migraine, suggesting that these brain areas could be putative drivers of the acute migraine attack. However, only one previous study demonstrated that the pons and hypothalamus interacts with each other during the pain phase of the migraine attack. So, how these regions interact with each other during the interictal phase and whether the Pontine-hypothalamic resting state effective connectivity could influence migraine disease activity has never been investigated. Against this background, the aim of our study was to investigate resting state effective connectivity abnormalities between the pons and hypothalamus in episodic migraine patients during the interictal phase and investigate their value in predicting migraine progression over the years. 91 patients with episodic migraine were in a headache-free state and 73 controls were enrolled in the study. All subjects underwent a clinical and MRI evaluation, including high-resolution T1 weighted and resting state function MRI images. 23 patients were also clinically re-evaluated after a mean follow-up of 4 years. So, interestingly, we found that compared to controls, migraine patients had a higher inhibitory effective connectivity within the left pons and from the right and left pons to the ipsilateral and contralateral hypothalamus. Migraine patients experienced also a lower inhibitory effective connectivity from the left hypothalamus to the left pons and a higher excitatory effective connectivity from the right pons to the left pons compared to controls. During the follow-up, 8 patients reported an increased number of migraine attacks, 11 patients reported a decreased number of migraine attacks, and 4 patients remained stable. Interestingly, in migraine patients, a higher inhibitory resting state effective connectivity from the left pons to the left and right hypothalamus predicted clinical improvement in terms of reduction in migraine attack frequency over the years. Our findings suggest that the hypothalamus and pons are functionally connected and exert an inhibitory activity on each other. During the interictal phase, migraine patients experience a prominent inhibitory influence of the pons over the hypothalamus, while the inhibitory influence of the hypothalamus over the pons is reduced. The higher pontine inhibitory activity on the hypothalamus could prevent the transition into the acute phase of the migraine attack, thus reducing the migraine attack frequency. We also show that a higher Pontine-hypothalamic inhibitory activity may be a prognostic marker for migraine improvement over the years.